one of the other things that was never explained to me is that like, oh yeah, midwifery model of care is so female and birth giver centered that like, we're not even trained in pediatrics. We're trained in emergency response to birth situations, but we don't really know what it looks like when a baby has swelling on the brain 24 hours after birth because of being stuck in the birth canal. And to know that like how many babies are dying that we do know about, that we don't even know it's because of home birth. And there is that stigma, there is that shame. A lot of parents who lose a child after an experience like what you or I have experienced, they don't want to talk about it. They don't want to deal with the people rolling their eyes and being like, well, why would you choose that? I know I get commentary about it from people, and I made an educated decision. I was lied to. Like, there is such a blatant, from start to finish, every answer was constructed. It was rehearsed. It was planned, and it was lies.
Mm-hmm. Yeah. It's not informed consent. That's
not it.
I learned that later. Like, you know what I mean? Because people started to ask me questions and they would say stuff. And I did not know what informed consent was. I was a first-time mom, so I really didn't know much of anything. But now when I look back, I realize there was no informed consent. There was no risk. There was no anything like, oh, you're only 5 minutes from the hospital. Like, here's your birth plan. Here's this. There's no like reality to the bubble that we're sold on, that we bought and sold into. So it was like, I looked into it. I jumped around and was in the communities. I listened to the birth stories. I looked up on my phone, like my son died in 2014. Like there wasn't very much out there. Like when I looked things up, like I could find a midwife online, but I didn't see that babies were dying. I didn't see that babies were getting injured. I didn't see that babies were even being transferred to the hospital or getting C-sections. I didn't see any of that. Like my midwife even tried to tell me the most reason that you would be transferred to a hospital is because you're a first-time mom. You might need pain relief, and then I take you to the hospital for pain relief. Like that's what she told me. She told me that unlikely to go to a hospital transfer because it just doesn't happen, but it does happen. And she's had it happen to her in the past. She had it happen in California. She had it happen down south. She's had it happen. She's been around, but she was like, oh, that's the only reason why first-time moms go to the hospital. Like it just doesn't happen. So I like looking back, I think about that of like, I bought into something that I thought was the safest decision. I thought it was a good decision. I didn't make it because I was just like naive, like whatever. I was naive to a certain level, but at the same time, what mother out there, any mother anywhere in the world is medically trained other than the ones that have went to school to be a nurse or a doctor? We're just not medically trained. We just don't know about our own bodies. We don't know about our babies. And yes, they are not pediatricians. Your baby doesn't come out and suddenly your midwife puts another hat on and now she's a pediatrician. That's not reality.
Well, one of the things that the argument that I've seen online multiple times is, well, they should have picked a better midwife, or they should have known when the midwife wasn't doing their job correctly. And I said, well, how would you know these things? And they said, well, they should have educated themselves. I said, so basically what you're telling me is that you have to have the same level of education and expertise as your midwife in order to to basically check your midwife on everything she is doing. And that's ridiculous. What are you paying for if that's what you're doing?
If I have to be educated to know about my birth, I'll just go to nursing school and I won't hire a midwife. Like, I'll just do it myself. I'll birth myself. Like, let's just do this myself. But that's the same thing. I heard that. I heard right away when I started speaking out, was like sharing what happened. They were like, you picked a bad one. And I was like, that's really interesting, since my midwife went online and shared what was happening on Facebook, and hundreds of midwives commented below, and I have their names, And all of them said, continue your home birth as planned.
Except
They
for the
all
comments
said
that were deleted.
Yeah, exactly. The only comments that was anyone saying go to the hospital were people that were not in the midwifery people. Like they were like medical people or normal people coming in saying she needs to go to the hospital. And all those comments were deleted. That's really interesting because you're asking a question. And if this is like, you really want to hear the answer, wouldn't you leave up the other side that's saying, oh, probably needs to go to the hospital? Just saying, if you're cool with, you're really asking a question and you really want to know, you would probably just leave it all up there. So, it can be gone through, which was the better one? I don't know. But no, instead they deleted all of that, which is I find that very interesting as the years have gone by of how many comments I have put and how many posts I have put that I've been banned. They have removed me. They have blocked me. They have bashed me. All those things for just asking questions or just saying the truth of what happens. Like they just, it has to fit their narrative into their business structure, or you don't fit and they got to take you out. You have to be removed. That's what I've seen after all these years is I've seen you either fit and you're in this perfect, like I just love, or you're out, you're booted. There's only two places for you. You can't be in between. It's one way or the
What's
other.
the word? Oh, supportive comments only.
No fear mongering.
No,
I'm a fear monger all the way because I share that my son died and they're like, that doesn't happen all the time. Oh, okay. Yeah, because I was told the same thing. And I had no risk, complications, no nothing wrong with me, but my son's gone. So what's the deal when I know people that have birthed VBAC, breech, twins, with a lot more complications than me, but you guys are saying that's okay, but I was super low risk. But unfortunately, I came to find out from certain doctors that first-time mothers are not low risk. That is a lie too.
Going past 40 weeks, not low risk.
Yes, there you go. Yes, and that if you go overdue, that is not low risk anymore. Every day after 41 weeks is so extremely dangerous. I believe I've seen the statistics that day one, it increased by 50%. The next day, day two, it increases that 50% by another 50%. Like it's literally like an insane amount of increases every single day. And I was 42 in 2 days, 3 days, something like that. Yeah, I was, because I should have had let's see. Yeah, that's right. It was like 2 or 3 days. So, but hey, it's cool. Go overdue. It's natural. It's normal. This is the way it's supposed to be.
Since we have lost mothers here, and I do have one question that came to me today when I was thinking about it was that in the spirit of informed consent and dutiful record keeping is that if every midwife who claimed patient refused whatever, usually transfer, if they had to get it in writing, how many times would we actually see patient refused transfer signed on dotted line, and as opposed to midwife said patient refused tests, patient refused transfer, patient refused care? It's like, it's amazing.
Isn't that all the moms somehow refuse this
they
care?
All do, especially when their baby dies.
Especially like they're midwives that they trust and they follow like their every word. But yet somehow we're refusing. I actually, that was one of the things that we waited for because we were hoping to bring up in the court case was where was the refusal waiver? Where was your paper? Because if you're in the hospital and a doctor comes to you and says, I think we need to do a C-section, and you say, I don't want to do C-section, they bring you a paper and you sign the paper that says, I refuse to do a C-section, or I refuse whatever medicine. Like, you sign it. So it is documented that happened at such and such time. People sign it. There's witnesses. But that's what I've always said. That I was like, where was my freaking paper? Where is my refusal?
I think in order for that paper to exist and in order for there to be a consent that you refused transfer, midwives have to actively and insistently offer transfer. And that's why we don't have that consent paperwork. The option to transfer exclusively. Now, like I said, the labor that I was having on paper does not look like the labor they were telling me I was having in that room. I instinctively knew something was wrong for the majority of my labor. And I kept asking, like, I probably asked 4 or 5 times if I should transfer. I myself was saying, am I safe here? Should I be transferring? I feel like I've been pushing for a long time. I feel like this has been going on for a while. And anytime, like you said, anytime transfer got brought up, it was for pain management. I remember at one point, my midwife was holding my swollen cervix back, and I had been pushing for like a half hour. My birth experience, I could equate to a birthing cow on a farm where like the farmer has their arms elbow deep the whole time trying to pull the calf out. That's what my labor looked like. And the whole time I'm sitting there saying, is this normal? You have been elbow deep inside of me for 5 hours. How is this safe? How is this normal? And they're like, well, if you want to transfer to Mercy Hospital so you can get an epidural. And when I was the one who was like, no, I didn't pick you guys because I want an epidural. Like, I picked you guys because I want a natural labor. Are you telling me I need a C-section? Conversation about transferring to the hospital really boiled down to whether or not I needed pain management, which is a really awful position to put a mother who chose a home birth midwife that doesn't offer pain management in. Yeah. Like, I made my decision at 5 weeks pregnant when I became your patient that I didn't want an epidural in childbirth. So if I'm not safe, you need to tell me that.
Yeah, I got mocked. Mine, the way that mine was put was that you'll need pain management because you're a first-time mother and first-time mothers can't handle it. That's what mine said. Mine was like, you're like, she like kind of laughed and had like a little joke around it about how like that's what they do for first-time mothers is they transfer out first-time mothers because it's just that you need pain relief. Like that's literally, I got mocked. So I was like, what? Motherhood? You know, like I really was like, I'm part of this. I'm invested. It's been months, whatever. I'm like, I don't need pain relief. And, you know, it just didn't go the way that we had ever imagined because that didn't happen. It was never brought up of what could happen, like ever. Actually, I remember when we kept saying, should we go to the hospital to get induced? Should we go to the hospital? I do remember like asking repeatedly and that she just was like, she was just sending us home. She was so busy trying to send us home. Like, you know what she referred to? And I'm sure like you'll probably remember like some of this old stuff. She actually referred to my no fluid as if you look up into a bathtub.
Oh, if you look at it just the right way.
The water. That's what she was saying to us as my child was like in distress.
And like, as she posted online, I love the description. It was, I feel nothing but baby.
Yeah. Yeah. She's telling us that, yeah.
She felt no fluid.
Mm-hmm. I'm like, I know now looking back, I was like, holy crap. Like, that's even scarier when you say it. Like, in her own words, she had already said it where I was like, I needed medical care. And you said it, but you don't even want to admit it to us. Like, she literally told us the bathtub thing before she checked his heartbeat and on the Doppler, found that it had dropped to 100, and then started making phone calls. So you literally were selling us to go home, and here he had dropped to 100. And then that's when we went over to go to the hospital. And in the records, just like you, Madison, my records were whatever. She gave her records because she carried them in her purse. She gave them to the doctor. But in the records was nothing about my ultrasounds. Nothing was in there about the day before going to 2 ultrasounds and there was no fluid. Like none of that was in there. She had told him on the phone that there was no fluid and that's how he knew about it. But in the records was nothing about my ultrasounds at all. None of them. I had gone to an ultrasound in January. She didn't even put that in there either. None of the things that had happened before was in my records. And it was all wrote. It's all hand wrote. Like, and the doctor, I know because in my medical records at the hospital, I got copies obviously, but it's there. They scanned it. They scanned what she gave them. And there's nothing about any of that. I had to tell the doctor that we went twice the day before and the day of, and he was like, I didn't know that. And I'm like, And he had already done his review, had already gone in front of the medical board and everything. And he did not know all the things because she didn't tell him. She didn't tell him everything. So it was just, it's just a freaking, it's a mess. Like that, just looking back at all that stuff, like how would you know, what research could you do to find somebody any better when they're all the same? Like it's all the same. Unfortunately, you know, I haven't heard of anybody who would make a different decision that's at home. I've heard of all the medical side of what they're like, oh, heck no, you've never been over 41 weeks. But you know what I mean?
The only midwife I know is whoever we figured out the midwife for Ghost Belly was. Do you remember that book? So anyhow, advanced maternal age, post-dates, intrapartum loss. And then she had another family who were going post-dates, and she said basically after 41 weeks, I will have to transfer you. And they said, whoa, wait a second, where did this come from? And they refused the transfer. And the baby died. And I believe I don't know if she quit practicing after that or not. But it was like every once in a while, a midwife figures out that she needs to change her practice. And I think the only ones I ever hear about are the ones who basically ended up leaving completely. It's like the ones with a conscience tend to leave. The ones who, frankly, enjoy the lifestyle and the income too much just keep going. I mean, the guy who owned the OB practice that I was at, I had an appointment with him because they just slotted you in with whoever. And he said something, he's like, what's the best time to deliver a dead baby? And I was like, what? He's like, the day before he died. And I'm like, oh, well, I get your meaning. It was kind of, he wasn't really good at the bedside manner, but yeah, he did get the point across that, yeah, the best time to deliver babies while it's still alive. And I don't think I've ever heard a midwife say that.